that now have helped all the young people to be around. Long time ago, children at 5 years were dying as if they were flies. But today, the population has become big because of this help that the president has brought about. So, achievements are there, and we must protect them. Anyone who does not see this certainly does not have eyes, because there is a lot to be protected, and it must be protected. I would like to end by saying this, that HIV is very expensive. I think those of us who have got HIV must help government to help us. Because when you infect a person, you are actually causing a problem to yourself. The need for more money, which may not be around at that time. So those people have got HIV, and I don't see why the HIV is still spread at this time. We are still 1.5 million people living with HIV. 930 women, 930,000 women get infected, are infected already. Who is infecting who? People who are taking drugs or those who are not? We need to examine this. Surely, if we have tried to get medicine to save your life, why should you infect any other person? I think we must have maybe a new approach. We need to think harder, because I don't see why the virus continues to spread. I thank you. Are you introduced? Mr. Who? I now take the pleasure to invite board chairperson of Nafofano administration, Vatim Salome. Thank you very much. You're welcome. Can I go down? I do not stay.
Yeah, you can.
Okay.
Thank you so much, Major, for that. The constituency, as usual, you're all welcome. Kindly come and join us. All persons living with HIV, standing in for their families, are welcome to the podium. Especially Bushenyi district, I saw the representatives around. The National Forum of People Living with HIV and AIDS Networks in Uganda is here to make a statement this 1st December 2025 in Bushenyi District Local Government at Kizinda Grounds. Our dear guest of honor, Your Excellency the Vice President of the Republic of Uganda, Major Retired Jessica Lupo, Minister in charge of Presidency, Honorable Babire Mili Babalanda, and all cabinet ministers present, Chairperson HIV Committee of the Parliament of Uganda, Honorable Netalisire Sarah Kayagi, and other members of Parliament present, Chairperson AIDS Development Partners Group, Chair and Director General Uganda AIDS Commission, LC5 Chairperson Bushenyi, and the district local government, political and technical leadership, Interreligious Council Uganda, Bushenyi District Local Government, Bushenyi District Forum of People Living with HIV Networks and Groups, LC1 Chairperson Kizinda Cell. Ladies and gentlemen, all protocols observed. Good day to you all, and welcome to this World AIDS Commemoration 2025. My name is Salome Atim, the Chairperson National Forum of People Living with HIV and AIDS Networks in Uganda, NAFOPANO, which Your Excellency launched in 2003. This self-coordinating entity under Uganda AIDS Commission partnership has since grown from 56 original district forums to coordinate 135 district peer HIV networks, including Bushenyi District Forum, 18 national people living with HIV networks, and 10 city PHIV living with HIV forums. Your Excellency, on this 27th Earth Day commemoration, we stand here before you representing the 1.5 million people living with HIV in Uganda to share this statement. We applaud your government for the support you have offered people living with HIV over the last 40 years of the HIV response. We are glad that you are still here to serve Uganda for another 5-year term. NAFOPANO is committed to joining you in the next 5 years to consolidate the 40 years HIV response gains within your leadership in positive health, dignity, and prevention. Your Excellency, today we mainly come before you to seek your support for 10 billion Ugandan shillings to secure land to build a home of champions living with HIV, to host the NAFOPANO Secretariat, which will contain a training auditorium, the PHIV circle, and a wellness center. The purpose of our request is based on the following. We evolved from the shadows of 1980 to today. Hope, a journey of resilience and courage. Your Excellency, as we commemorate World AIDS Day, we reflect on Uganda's journey through the strain, pain, and crisis of the early HIV epidemic. A time when information was scarce, fear gripped communities, and death devastated villages. We remember the bold efforts of the government, especially your efforts to confront HIV stigma in the late 1980s. We honor the early activism of pioneers like late Philip Bongole Lutaya and others for their courage as people openly living with HIV who organize through post-test clubs and initiatives, especially community burial support groups. These groups broke stigma, demanded rights, and provided hope. We educated peers, offered psychosocial support, and met basic needs. We conducted home visits, delivered home-based care, and provided bedside services to the bedridden, helping them live positively while awaiting scientific breakthroughs. While thousands died, we did not relent. We supported each other. We volunteered tirelessly as unseen public servants, partially heard, driven by Ubuntu and the strength of our social ties. We opened our homes to orphans, cared for them pro bono, and acted out of passion, born from pain, loss, and the determination to save lives while surviving. We recall our role in research projects and programs, offered blood and other specimens to advance science. We witnessed the first art trials, PMTCT, oral TB treatment trials in 1994, DAT in 2003, Test and Treat in 2016, and many scientific trials that became global models. We gave ourselves freely because we needed to live, sometimes sharing doses of art just to see another day. We put ourselves in harm's way to save lives, ours and others. Today, we look back. We honor the resilience, sacrifice, and solidarity that has carried us through. We continue to work despite the funding cuts, unwavering in our desire to save, but mostly save another life. We are leaders and we lead. We have led the fight against HIV stigma, facing it head-on, and reclaimed our dignity through positive health, dignity, and prevention. We share our stories without fear and empower others to access HIV services. Today, 94% of Ugandans, 1.5 million people living with HIV are on ART. 91% of these are virally suppressed, thanks to our joint efforts. We lead stigma index surveys, inform government and partners about realities we face, and tell our stories in clubs and organizations. We empower new members to manage programs, attract resources, and champion treatment literacy, adherence, community mobilization, service quality monitoring, and prevention initiatives. We have built structures that have endured for 30 years, running from national, district, sub-county, parish, village level, support groups, and family. We have nurtured champions, mentor mothers and fathers, parasocial workers, young adolescent program support, and peer educators. Most of this work was and is being done voluntarily. However, we are faced with funding crisis. Despite our resilience, the funding crisis has hit us hard. Prevention and education were paralyzed. Community initiatives like differentiated service delivery models froze. The Ministry of Health issued a circular on February 7, 2025, mandating integration and closure of standalone HIV and TB clinics. People living with HIV networks and associations, already demoralized, faced panic with reported long queues at facilities, recurrent art stockouts, reduced privacy and confidentiality, continue to live in fear. Adolescent corners, safe spaces, shelters, and drop-in centers closed or relocated to unsafe spaces. With funding cuts, the most marginalized were excluded again. People with disability, adolescent girls and young women, the older persons, among others. People living with HIV organizations and networks closed or now operate at suboptimal capacity. Discussions continue under the National HIV Response Sustainability Roadmap to secure intentional funding for community health workers and structures that have played critical public service role for the 40 years side by side with village health teams. The NAFO panel launched in 2003 to protect people living with HIV rights and ensure coordinated representation that has led for 22 years, mobilized 135 district forums, 18 national PLHIV networks, and 10 city PLHIV forums, is at the verge of erasure. Funding cuts led to paralyze PLHIV-led community interventions. Over 8,400 community health workers, majority people living with HIV, and staff layoffs, unmet infrastructure needs, and loss of livelihoods is being experienced. After 22 years, NAFOPANO vacated the premises in 2025 from a building that was condemned and now operates from Uganda AIDS Commission Resource Center while fundraising for a permanent home, a home of champions. In addition, many national and district PLHIV networks previously hosted by NAFOPANO have closed, further destabilizing the PLHIV community access to HIV and other related health services. Your Excellency, as we rise and recover, this is our call to action. With the National Forum of People Living with HIV and AIDS Networks in Uganda and our members reaffirm our role as partners in the HIV response. We pledge to recover from funding cuts, mobilize resources, and continue support to the 200,000 PLHIVs not yet in care, 200,000 lost to follow up, and 60,000 non-suppressed individuals. We will sustain support to the 1.3 million people in care and guard jealously our 40 years HIV response gains. Your Excellency, to consolidate the above gains as stated earlier, we seek your support to secure a home to center our programs. With no home to operate from, coordination becomes difficult. We by this statement request for 10 billion Ugandan shillings to secure land and build a home of champions to host our secretariat, the training auditorium, the PHIV circle and the wellness center, which is being projected right there. We call on government and partners to invest in supporting to restore the national PHIV programming to ensure sustained community mobilization, treatment literacy, psychosocial support and adherence, including requesting the district local governments, city councils and sub-counties, municipalities to offer space to host all the district or city forums and other sub-national forums, as well as other networks that have closed due to the funding cuts. Uganda public service pillars, especially peace and investment, should include people living with HIV as mutual partners in national development. As community public servants, we people living with HIV continue to demonstrate patriotism and solidarity, driven by a passion for promotion, protection, and respect for human values. As I conclude, Your Excellency, the people living with HIV leadership and I wish to meet you in person soon, if it is agreeable to you, to further share our proposed Home of Champion request and discuss how we can continue to complement government to eliminate HIV as a public health threat in Uganda. We the people living with HIV shall not surrender until HIV and AIDS is history. Together for positive living. Thank you.
Bantumena nishabangu speech tutero mungaro ne speech nkuru kandi nja niyo speech nkuru mnonga yona kunkoru kureba abantu abakuhangara n'akakoko ka sirimu baroho bina magara kandi bakonda kuongera amana gabo aharyagwaga gavumenti okurwanisa oburwiro. Your Excellency the Vice President, it is indeed true that this for us is the most important speech of the day, because as a wise man once said, there is nothing for us without us. And so this is what the message from people living with HIV and AIDS are saying on such a day, that you will not come here as a nation to commemorate the International AIDS Day without their voice being heard as people living with HIV and AIDS. And in fact, as you heard in their speech, they now call themselves champions. So the champions and your leadership, please proceed and go shake the hand of the Vice President. And you know they have many instructions, and among them they are saying, can we have a photo with her? She is there for you. She is a very amiable Vice President. She will not only allow a photograph, in fact she may take you with her. Your Excellency, as you meet and greet the leadership of people living with HIV and AIDS, I wish to make a brief announcement. Abantu babushenyi n'abajenya batweyungaho hari shitongere kibarkweta Uganet bina hatenti. Uganet is the national network for law, ethics and HIV and AIDS. Bino butumana bajya nkora abo ino mushango gwona narashenshonga yone kushobiri abo kugira ngo iwe oyinaka ko kasirimu narshi orukwataho hino kwa rumuna atwazwa kubi era no mbingo munju nabagiza kumuyaha ekibanja bakamuyima abana emishango n'umujimanya nkeje uri kuteganisa abantu kandi ibyo nabikorwa abagenzi bitu abo kandi batekateka nko kuba inako kasirimu no basapoti ino ko kubasa kwebasa mwena aba Uganda no bajangu muze ya tenti yabo obashobore nshonga yawe nabo nabaza kukwatiraho kandi bakuhereze amajezi bakwatireho otarukushashura sente yona. To put it in English, Uganda is running a pro bono legal clinic for people living with HIV and those gravely affected by it. So please get a moment, pass by their tent and receive their services. May I request the chairperson of Bushenyi district for LC5 to be on his way so that he makes the statement. Sebo nahura no bakweta governor wechwekeji lazima bwa governor no busha mwen sebo twakira ngo ije mwamba saja baraba haje bigambo bice ebwa tuganira urukureba mukama wihanga vice president chairman wanyu mutero mungaro bantu mwe tumwamushemerwa.
Thank you very much, Kagambizi Umukoro. Our chief guest, none other than the Vice President of the Republic of Uganda, who is representing His Excellency the President, His Excellency Yoweri Kaguta Museveni, Member of Parliament and Ministers present, all protocol observed. Your Excellency, the Vice President, we have a number of people, but I want first to recognize my fellow chairpersons who are here to commemorate with us. We have these chairpersons of Southwestern region. I saw Chairman Buhwezu and others, the Chief Administrative Officer, resident district commissioners, our religious leaders, Bishop of West Ankole Diocese, the regional card, our parish priest representing the Archbishop Lambert Binomugisha, our distinguished ladies and gentlemen. On behalf of the leadership and the people of Bushenyi district, I extend our heartfelt appreciation to the government, especially the President of the Republic of Uganda, His Excellency Yoweri Kaguta Museveni, for accepting our request to host the national or world celebration of World AIDS Day. This honor reflects the confidence and trust placed in our district to champion the national response to HIV/AIDS, and we are deeply grateful for the recognition. Uganda was one of the first countries in Africa to acknowledge the AIDS epidemic, reporting its first case in 1982. Since then, the country has made tremendous progress in combating the disease. HIV/AIDS has been a major public health concern in Uganda for over 3 decades. The disease spread rapidly in the 80s, with the infection rate picking up in the mid-1990s. Hosting this important commemoration is not only a privilege, but also an opportunity for Bushenyi to reaffirm its commitment to fighting the epidemic and promoting the well-being of all citizens. This is especially important given that Bushenyi's HIV prevalence rate currently stands at 8%, significantly higher than the national average of 4.9%. With Chizinda Town Council are identified as one of the key hotspots within the district, we thank the Ministry of Health, the Uganda AIDS Commission, and all government agencies for their continued guidance and collaboration. The decision to bring all this year's celebration to Bushenyi underscores the value of partnership and the importance of bringing national events closer to the communities most impacted. It also strengthens to resolve to intensify care, treatment, and support services across all sub-counties and sectors within our district, particularly in hotspot areas that require heightened attention and resource allocation. We further appreciate the government's ongoing investment in health system strengthening, community harmonization, mobilization, and HIV/AIDS program that have significantly contributed to improved health outcomes in our region. This support has empowered local leaders, health workers, and building resilient communities as we confront higher than the average prevalence rate. This partnership remains vital in guiding evidence-based intervention and assuring communities as we celebrate this year's World AIDS Day. Bushenyi District stands ready to deliver a memorable and impactful celebrations. We praise our full support, cooperation, unity, and commitment, ensuring that the event raises awareness, inspires action, and reinforces the national agenda of ending AIDS as a public health threat. Once again, we sincerely thank the government for choosing Bushenyi as a host. Your Excellency, the Vice President, I want also to thank Uganda AIDS Commission, headed by the chairperson, Dr. Senyonyi, who is present with us, the Director General, Dr. Musoba. We also want to thank the County Director, UNAIDS, Madam Jacqueline Makoha is here, and others, plus our district, headed by none other than our Chief Administrative Officer and his staff. We have the political leaders, our district councillors, chairpersons, His Worship the Mayor, all are here to make sure that this event becomes colorful. But, Your Excellency, we have challenges. When our dear Minister of Local Government was here, he talked about the issue of making sure that we integrate or we incorporate members of those living with HIV/AIDS to make sure that what we do when we are giving out government program goods and services, we make sure that we include those people who are living with HIV. But the problem is, Madam Vice President, it's very difficult to identify those who are living with HIV to make sure that we make them part of that arrangement, because disclosure is very difficult. Last but not least is the issue of having health centers. Abishemwe abaryaha obuzibu butwine kandi butwenda mukuru w'ihanga ayazwekirwa Vice President omuchwekomu ekyakizinda Town Council twine mu health center 3 nka policy ya government kwegamba kandi twenka Bushenyi local government. We have already allocated a place in Kigoma irwara yo ehiryaza nani njan mutero mungaro nekintu niwara atakakigambi echamuheru I'm a politician, I'm a district chairperson. na ninyenda abarya of protecting against as been achieved by the NRM government twantwenda every 15 teremze chikofira akaruru Museveni oye Museveni abeho kandi umuhereze n'ensagarizi ezirabe ziri yero abo kuba yero nekorana yero nebyo kambendeza okubahanuya kandi tomorrow nyencha kare aha mwanya ngo gumwe tuza kubantu twakira omukundwa witu His Excellency the President kandi akwatire NRM kibina kitwe bendera nyencha kare mwizo mbwingi tumusupporting ebendera egumerya higuru mukimanye Bishop Peter Roba kugira ngo harihe bendera ne bendera. Your Excellency, our Lord Bishop normally tells us that there is a flag and there is a flag, meaning a flag ya mani ahona naka flaga obuchi mwenchaka mwize twakire bendera rero every 15 tukiterere akaruru egarite twari myaka 5 nebyo mukama gumeni hada. Assalamu alaikum wa alaikum salam wa barakatuh. Nasigarandi honorable basajja baraba Jafari, district chairperson our Bushenyi district. Mwebale mnono.
Thank you very much, Mr. Chairman. Your Excellency, whatever goes wrong today, now we know who to blame, who to hold accountable, and that includes whether the weather changes or not. So when Chairman w'umwanya ogu otwesere ngunoza to your hostess, we hope and we continue to enjoy your hospitality, and we hope that nothing goes wrong. Funza program here is over. May I now have the pleasure to make the following announcement. People of Bushenyi, the issue of HIV and AIDS is very important and dear to His Excellency the President, that he put it directly under his office. And so the Uganda AIDS Commission is part of the office of the President. And the office of the President is so important that it has a minister of the presidency. Honorable Miri Babaranda, as the Minister of the Presidency, please stand up and the people of Bushenyi see you to show how serious the issue of HIV and AIDS is to His Excellency and the government of Uganda. Nwogo Minister wa President, ninja bukurweni mbureba, the Minister wa President, kandi office ya Minister ogu, nimwari meshitongore echikurra emirimo ya government ekwatirine na sirimu, your AIDS Commission. Mwena nebyo, may I request humbly that together with your chairperson, Dr. Nelson Musoba, the Executive Director of Uganda AIDS Commission, together with your chairperson of board, Dr. Ruth Senyonyi, please come and share with us what I normally joke with you as your annual State of AIDS report. But from the program, it is regarded as a progress report on the implementation of the Presidential Fast Track Initiative on ending AIDS by 2030. Bantumwe ogunwe abamba kukoresha ikitongo cya Uganda AIDS Commission nani shabangu tubatero mu ngaro. Emirimo ya government yone rukwata na kikoko cya sirimu abantu bachikwatirireho umuhurano bagira ngo sirimu twaje rwanisa twaza kugitera hansi aba nabo bebembire ekitongore ekyo. Over to you, Madam Chairperson.
Your Excellency, the Vice President of the Republic of Uganda, who is our chief guest today, the Honorable Ministers present, Honorable Members of Parliament, Your Excellencies,
Uganda! Uganda ya yellow, Rwanda ya yellow, 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 yellow Museveni, yellow Yekaguta, Mama Janeti, Nabakunda munonga batubwe. Tugende balamu. Waliwo chairman mubale balamu. Ekula ya Afrika chairman musajja mulungi nnyo. Tunayimba tuyimbe. Ensonga y'oweri.